So, good morning, chairs and my colleagues in the audience. I'm Dr. Maulesh Gadani, working as a medical officer in Space Application Center, ISRO, Ahmedabad, and I'm doing my PhD from LJ University. So, based on this, I would like to highlight today's topic, which is a little bit different from diabetes management, but yeah, it is somewhat linked to that. So, the topic is synergistic benefit of probiotics and Nano Ashwagandha in enhancing the diabetes management and probiotic functionality. So I would like to introduce that ISRO is planning for main mission, and very soon we are going to send humans in space, and they are going to stay for a longer time in Bharatiya Antariksh Station. So there are a lot of problems happening in the astronauts, and recently our astronauts has gone in Axiom mission, and we have found out that yes, problems are developing, and one of the key problem which is highlighting in today's conference is development of diabetes. For the same, one of the research was done in Axiom 4 mission, that one of the company from UAE has sent insulin pan and CGM monitor in International Space Station, and the functionality of that was found out, and it was found out that it is at par as on the Earth. So linking to that direction, what I am doing research right now on the probiotics, these are some of the introduction that spaceflight condition including microgravity and confinement, artificial lighting, environmental stresses, this are all altering the gut microbiota, and the alternating gut microbiota will lead to many problems due to many axes linked in our body. So that can negatively affect insulin sensitivity and glucose metabolism. Certain systematic reviews and meta-analysis have suggested role of probiotic supplementation in reduction of fasting blood glucose ranging from 9 to 5 milligram per deciliter and HbA1c levels by 0.3 to 0.54 percentage. It also improves insulin sensitivity and reduces fasting insulin levels, and they also support in better lipid and inflammatory profiles in type 2 diabetes. The inflammatory condition is very much linked to development of macrovascular and microvascular complications. Probiotic supplementation is not a replacement of our conventional antidiabetic therapy, but yeah, it may be useful as an adjunctive therapy if we use it. So current guidelines which are focusing lifestyle modification at first, which is highlighted in a very small fonts, I think this may become part of that. Same time, the synergistic effect of Nano Ashwagandha along with this probiotic coating of Nano Ashwagandha on that may further contribute in better glucose control. So my objective was not directly checking the glucose levels, but the first step just to assess the effect of different concentration of Nano Ashwagandha on growth of two probiotic strains which are commonly used, Bacillus clausii and Lactobacillus rhamnosus GG. This we have study we have done in laboratory. So in the literature review, the rationale we have seen that probiotics improve glycemic control, as I said earlier. It also helps in reducing oxidative stress. It decrease blood lipid, improve blood lipid profile and decrease body weight with minimal safety concerns. Ashwagandha possess anti-diabetic and adaptogenic properties which enhance through nano formulation, and combining both may deliver superior metabolic, anti-inflammatory and gut microbiota modulation. This is the Su-tried experiment which I was talking about recently done in Axiom 4 mission. The methodology we have seen is the bacterial strain collection was done and revival was done. All morphological and biological characterization was done to confirm that this is the same strain. The growth kinetics under normal conditions was observed, and the Nano Ashwagandha characterization was done, and with different concentrations of Nano Ashwagandha, it was inoculated in the petri dish which is inoculated by these different bacterial strains, and the growth kinetics was observed, and finally statistical analysis was done. So these are some of the results what we have got, that all the concentration of, before that I want to show you these two graphs. First, left hand side graphics effect of Nano Ashwagandha on the growth of Bacillus clausii, where you can see the black line is the control, and the lower lines which are in different colors, those are the different concentrations of Nano Ashwagandha starting from 200 microgram per ml to 0.02 microgram per ml. And the similar situation is on the right hand side, which is the effect of Nano Ashwagandha on the growth of Lactobacillus rhamnosus GG. Here we have observed that on the Bacillus clausii, Nano Ashwagandha is giving negative effect and the life of that bacteria is decreasing. So here it is not giving any synergistic effect and it is giving opposite direction. But on the right hand side, if you see the purple graph, which is 20 microgram per ml, it is giving little bit advantage, not a good, because almost all are looking similar. So here it is matlab not inhibiting, we can say, but again we are not getting very good synergistic effect. And this is the conclusive result, that all the concentrations of nano ashwagandha enhanced bacterial growth and were found to be non-inhibitory, while there were no significant difference observed in the growth of the bacterium between the control group and the treatment group, indicating that nano ashwagandha did not inhibit Lactobacillus rhamnosus GG, while in Bacillus clozi it has inhibited the growth. So now further research is ongoing, and we are going to see the effect under simulated microgravity environment also by RPM machine, and I hope in next year conference I may present those results. So what the discussion is that nano ashwagandha selectively enhance the growth of Lactobacillus rhamnosus GG, and further research in this direction may give us a good result, while Bacillus clozi is not giving good effect. The maintenance of viability presence in the nano ashwagandha supports in safe inclusion of symbiotic formulations. It can be used for diabetes management, and a pill formulation with coating of this type of nanophytonutrients, if it can be given to humans on earth, and if it gives good result, and if it is approved, we can give it to astronauts also when they will go in the space. So that will further give many benefits. So at last, further research is recommended to clarify the mechanism. I don't know which mechanism is helping in decreasing the fasting blood glucose and improving the lipid metabolism. So further research in this direction will be very much helpful, and this is the conclusion, that extension of life of this probiotic strains will further help in maintaining the gut health, which will further improve all the gut related access in the body and will give good effects on human body. These are certain references, and I would like to acknowledge my guide Dr. Viral Shukla and co-guide Dr. Kedar Ahire from Savitribai Phule Pune University, under whose guidance I am doing my current PhD, and their continued support. Thank you very much for patience listening.